large GBV community. Oh, Pamela, I'm glad that you're here because I was going to ask you to present your session for the HNPW. So it can be you instead of Shiva or somebody else. So that's great. So that'll be our AOB, Joe. So you'll have to end on time so we have time for our AOB. Oh, okay. So you guys, I'm just gonna let everyone know who's speaking. I'm gonna have this little bell sound. That's when you need to stop talking. Then I don't have to interrupt you, okay? If it sounds horrible, I'll try to find something else for the future. So I'm gonna welcome everyone. I realize that we're only like 1 minute over, but we have a full agenda. So I think we should go ahead and start. Actually, I don't know if you can hear my background noise. Hopefully that's better. Okay, so we have a full agenda today, a very exciting call. There's been some miscommunication around the length of the call. So my apologies if I think in the invitation it said 90 minutes, but then the calendar invite was put into your calendar for an hour. So that was a mistake. The good news is starting tomorrow, we're going to have our own Zoom account as the GBV AoR. So we hope that we'll have, we will have less mistakes moving ahead. So that's exciting. And just to say, we will be on for 90 minutes. If you have to get off after an hour, then please do follow your own schedule. We are going to record so that we can share this afterwards for people who could not make the call. And just to say, I think that's it. Yeah, I think that's all I wanted to say at the beginning. So we're going to go ahead and start. And first we have Fulvia from Whole of Syria, who's going to talk about their new report that just came out called Beyond Numbers. And Fulvia, can you actually just mention quickly what is this UNFPA knowledge series? So we know what that means, especially for people outside of UNFPA. And just to say, we're excited because we're always having discussions around data. And I think Whole of Syria, we've had them featured in the past on their Voices report, which we think is quite admirable because it includes a lot of qualitative data, which can be used when we're all doing HNO HRPs at the field level. And just to say, we do have a number of coordinators on the call and folks from the field. So it's always exciting with our new calls, which we are intending to have once a month for 90 minutes. We are balancing between folks in the field and field experiences, in addition to new guidelines and new tools that are coming out at the global level, as well as global resources. So that's what we're trying to do. And if you would like to present something on a future call, please do get in touch with Shiva, who's organizing the agenda. And we do have also Tenzin on the call talking about cash, this new WRC report. And I know last month we had a conversation on cash that Luana led, who is now on maternity leave. So we had to get her in before maternity leave, and now we have Tenzin in with her new report on cash. So we're well covered. So turning over to Fulvia.
Thank you very much. And thanks for the time to present this, which is our first knowledge, the first product of our knowledge series, as you were mentioning, Jennifer. So my name is Fulvia. I'm the Whole of Syria GBV coordinator, and I sit at the regional Syria hub in Amman. And as the hub, we had this idea of producing a series of knowledge projects that want to support the humanitarian community with the simple and replicable best practices, good practices that have been collected it's actually a regional level for now. So that have best practice that have been collected in the Arab states. And this one, Beyond Numbers, is our first product. And the publication is basically a guide to all GBV coordinators and also GBV experts on how to safely gather GBV data in a humanitarian setting in order to inform the overall GBV response. Can you move to the next slide, please? So Beyond Numbers have been based on the experience, takes from the experience of Voices from Syria, which is an assessment of the GBV situation in Syria that has been produced on an annual basis for the last 6 years now. And the main objective of Voices has been to support the GBV response in the humanitarian setting in Syria, but also through the identification of GBV risks in other sectors, support a safer response from all different sectors. Voices from Syria has been identified as a best practice according to an independent evaluation of the regional Syria response that happened a couple of years ago. But more recently also we submitted the overall assessment approach to interaction results-based protection good practices contest, and it got an honorable mention. So and also it was presented as a good practice during last SBRI meeting. So I think that if you can move to the next slide. So as I mentioned, the main aim of these Voices reports have always been primarily to support the implementation of the GBV programs in Syria, and also to be used as a resource for humanitarian actors to mitigate the risks of GBV. But the impact also went beyond these two initial aims that we had given ourselves. And the one that I think we are probably most proud of is related to how these reports really highlight and amplify the voices of women and girls that are often invisible in the humanitarian response, and how it highlights the overall environment and the GBV risks that they continuously live in. I did touch upon the improved response, and this is done because of providing GBV organizations with somehow detailed and nuanced information on the GBV types, but also consequences, coping mechanisms, locations where GBV mostly happens, and locations where people feel are not safe, etc. It has really supported advocacy efforts, as it provided evidence to inform the humanitarian leadership of the protection situation of women and girls. And with this, of course, also it has supported continuous advocacy for GBV risk mitigation to be a shared responsibility of all humanitarian actors in the response. It has supported funding, as donors know exactly what and where to expect to find the information, and it has supported, given the feedbacks that they have provided us, it has supported also their own prioritization. Yes, next, please. So I think that we can go a bit more in depth on what actually the document of Beyond Numbers, what you can find in the document and how it is structured. So really what we wanted to underline is the methodology that we used, going a bit in depth on all the different steps. So you have all the process of data collection. I didn't mention, but Voices is mostly based on qualitative data that are collected through community focus group discussion and expert focus group discussions, but also it relies on some quantitative data, mostly proxy indicator from the multi-sectoral needs assessment. So in the process of data collection in this Beyond Numbers document, we go in depth in all the different steps from how did we develop the tool, what were the information that we wanted to capture, and what were the gaps in information that we had, to how did we sample, how did we, the communities, who conducted the focus group discussion, and in our case it was protection, child protection, mine action, and GBV actors, so a joint responsibility of all the protection sector. How did we select this organization? How did we train them, etc., etc. And then I think that, yeah, I mentioned also the sampling, like what criteria did we use, and of course it is important to note that all the information will, we hope that will be a guide, as said, but will need to be, all the approaches will need to be contextualized if this is going to be replicated in other sectors. Sorry, in other sector, in other contexts, in other countries, which is our hope and a bit of one of the main reasons why we published this document. The document then goes on talking about the analysis and the report, and again going a bit into in depth into how we did the analysis based on a previously coding that was done using a software that for us was MaxQDA. So we also mentioned what is the added value of using such a software for qualitative data analysis in our experience. And then we do go into a bit in depth into the report and for example, also how we, the types of report that we produced. So more recently, based on some feedbacks we got, we wanted, we realized that we wanted to have a shorter brief, an advocacy brief of 4 pages that we can use to disseminate, and that was very useful for donors and humanitarian leadership. We touch upon the dissemination, we touch upon the budget and the timeline, and we also have a COVID-19 dedicated session, which is based mostly on the experience of this year. And yeah, I think that there are the way that the document is structured is that we first have some points to consider, kind of tips, and then we go into more in depth into what has been the experience of Voices from Syria. So an example of what has worked. Next, please. In terms of the budget, so one of the frequently asked question is, but how much does this cost? And it seems like this is a very expensive process and a very expensive assessment. So we do underline also in the report that it really depends on what is the budget, and the budget should not be a reason not to conduct the assessment, but rather, of course, adaptation of the assessment to the budget that is available is our suggestion. But in terms of what has been our experience, the costs related to human resources are the time and effort of the GBV coordinators and the GBV IMO that will, of course, lead on the overall assessment, as well as, if possible, the support of one or two external consultants, depending on the number of focus group discussion, that were very helpful, especially in the analysis and the report writing. The translation costs for us, of course, in Syria is not an English-speaking country, so we had to translate the tools first, but I think that the bulk of the translation is translating the focus group discussions themselves from Arabic back to English, and this can be quite costly. And then also the costs of the translation of the report. As mentioned, the software, so MaxQDA in our case, but possibly this is just one of the options. And then the cost of the publication. So we normally ask for copy editing of the report, and then we have a proper design of the publication. And then if you want to print it, print the report, print the advocacy brief, and also then the costs whenever it will be possible again to have in-person meetings or presentations, etc. And then costs related to the dissemination of the report. Yeah, and I think that, yes, if you want to switch to the next. I think that here are just some of the quotes from women and girls themselves, and the one on the top right, we girls and women are the most oppressed. I think a little bit more repression, and they will hold us accountable for the breaths we take. We've put these, this is just one, but we put these here because of course, all GBV work can be quite emotionally intense, and this process can also be pretty intense from the emotional side, because what has been our experience is that the report is based, we try to write the report based on the quotes of women and girls themselves, such as this one. So we do have a lot of interesting, but also once more emotionally intense content. And I think that we see this report as kind of also a moral responsibility to amplify these voices and to go beyond the space that we have in the humanitarian needs overview. We do conduct this assessment in the framework of the HNO, but the report goes much beyond what the space that we have in the HNO. And lastly, in terms of next steps, what we are planning to do is to record, and we are already doing it this week, recording 2 podcasts. One will be a bit of an introduction to the Beyond Numbers document, and one will have a bit more details of each of the steps that are described in the report. We are presenting it here, but we are organizing hopefully also a webinar for Beyond GBV coordinators, for other GBV experts. And Sudan and Somalia are already working on their voices from Sudan and voices from Somalia, using a similar methodology, and I think Sudan presented in the last meeting as well. And then also, as I mentioned, the interaction results oriented protection best practices. They're planning to have a blog post and a publication with including this one as a good practice. And yeah, and that's it. I hope that, of course, you can get in touch if you have an idea or you're planning to replicate such a methodology in your own context. But happy to take some of the questions right now as well.
Thank you so much, Fulvia. And we actually have time for questions and answers. I have also said that if you, for some reason, can't use your microphone and you want to put your question in chat, or for the next presenters also, so you don't forget your question, we are looking at the chat and can raise the questions there. I don't see any questions right now in the chat, but there are some comments, which Jennifer Miguel is saying that the replication depends a lot on the need, and so it does not have to be expensive. And Noemi is making a comment of imagining that mission fees can be a big part of the budget. Although, Fulvia, I'm wondering if you can say something, because I think, you know, you guys were already, because of working cross-border, you were already doing a lot of the work remotely in a way through your partners, including the training. Now with COVID, I feel like that's even more relevant. Do you want to just comment on that?
Yeah, sure. Yeah, so in the past, yes, some of the training had already happened for the facilitators of the focus group discussion, had already happened remotely because of some being based in Syria, while the coordinator were based in Gaziantep. So we built on that for this year, and we extended the training online to all facilitators throughout the country. But also we adapted a little bit the focus group discussion in terms of the number of people that could participate, etc. But because, as said, these focus group discussion are conducted by the protection actors in the field themselves in the field, and we normally ask them to conduct the focus group discussion in the communities where they are already working and where they have trust of the community and good access, etc. We also left a bit open for them to decide how to conduct the focus group discussion based on the restrictions in their specific geographic area, as well as based on what were the limitations. So we had a number of different methodologies that were used, either reducing the number of people participating, or like I remember that one organization mentioned that they had invited the different women in the Women and Girls Safe Space, but they had placed a laptop in each of the rooms of the Women and Girls Safe Space, and only had 2 women or 2 girls in each room. So and the facilitator was in a different room with another laptop. So the focus group discussion happened within the Women and Girls Safe Space, but still through somehow remotely through the laptops and the connection. Others had it also used using WhatsApp, so not really in person. So we have mentioned that as a kind of a limitation also for this year's voices, but I think that overall it was also an interesting process and a lot of lessons learned.
Yeah, I think you guys were cutting edge before COVID without knowing it, looking how to do remote training and working with women-led organizations cross-border. I think showed that some of these things can be can be done even before the rest of us learned it with COVID. So there's a couple more comments. Joe Reed is asking about if voices from Tigray would be possible, since there's an pledging conference coming up, and asking about turnaround. And then Farid Gol, who's one of our coordinators in Iraq, said that they're very interested in replicating and is saying he'll reach out. Just maybe you can mention, Fulvia, that you have actually And I know Jennifer Miguel is online too, but just say something that you have created now, a tool that explains how you can replicate or contextualize this experience. And I think that would answer the questions to both Jorit from CARE as well as Farid in terms of understanding better the whole process and the timelines, because it does go beyond just having a focus group, right? There's a lot of work that goes into it that does take up some time. So maybe you can say something about that tool. And I don't know if you have access to the link that you could put it in the chat so that people, we will put it in the minutes. But if somebody like Jennifer Miguel or someone wants to already put it in the chat, or after you finish, you can put it in the chat, then people can already access it. Oh, there it is.
So this is the link to Beyond Numbers, which is this publication that I just presented, and where you can find the details of the assessment. In terms of time frame, so as mentioned, we normally follow the time frame of the humanitarian needs overview. So it does take us, so it's a multi-month process. We have had around 100 focus group discussions happening every year, more or less, plus the expert focus group discussions. So it does, it is kind of a lengthy process if you want to follow the similar steps. But so I don't know exactly how urgent that is, but we can maybe have a bilateral chat on this.
I see that Jennifer Miguel is responding to Sarah Martin's question about if this data is shared back to the women and girls to think about how they can improve programming. Do you want to answer that verbally, Jennifer Miguel?
Hi, everyone. Sure. No, just to say that indeed, like just okay. Firstly, on the timeline, though, I mean, I think it really depends, because what Fulvia's presented and this product just shows you the steps that you could take, but there's flexibility in that, right? You can go as quickly or as you can take as much time as you need. It just depends on what's already in place, right? So I would say that you could definitely do the whole process for Tigray, but if the conference is coming up, what we have also done in the past is that, for example, the Voices from Syria is quite a long process. It's quite a big document at the end. We provide all the information because you need it for programming, but we put out a short advocacy brief beforehand that has just the main highlights and the main key messages. So you could also think of doing that potentially for Tigray, right? So start the process, but at least pull out the main issues that have come out already. And then, of course, I mean, a lot of this data, I mean, all this data is based on discussions with women and girls and men and boys, and so there's recommendations that are that come out directly from them on how to improve the response. But I'm sure Fulvia will want to add as well to what I'm saying.
Yeah, no, also like in the report, the whole section of the recommendations is also based on quotes. So, I mean, developed with the quotes and based on the information that was gathered. So it definitely has a lot of the recommendations are for improving the programming. Yeah, so it's a way that how we also kind of engage them in recommending what they want to see as a change, and also recommending how they see themselves as part of the change.
Great. And just to say, I mean, every time you guys have presented, there's always a lot of interest. And I know at SVRI, there was also a lot of interest. So just to say now that we know that Sudan has been working on this some time. I don't know how long Somalia has been working on it, but if there's interest, we could organize a webinar in the future and have Somalia and Sudan also on the call to talk about their experience of contextualizing this, because in whole of Syria it's been with the protection and the 4 AoRs, and in Sudan it's only the GBV subsector. So, you know, it'd be interesting to hear from them also about how they're adapting this to their context and how they're finding it. Since there's different sort of levels of development and communication methods, and, you know, some, like we said, whole of Syria has been looking at the different hubs and going cross-border. Sudan, there's no need to go cross-border. So it could be interesting to hear. They're at much earlier stages of the process, but if you're interested in replicating, that could be useful. So do let us know if that's something you're interested in, and we can look at organizing that in the future. So our time is up. I see that Fabiola is now writing something. Yeah, go ahead.
Just one more thing that I wanted to mention, that I see a lot of GBV coordinators that are on this call that are or have been part of these processes. So just a big shout out to all those that have been engaged in voices and in the development of Beyond Numbers, as it's really teamwork.
Great, thank you so much. And again, as it's been mentioned, it is sharing women's voices, and for all of the coordinators who get very frustrated by the limitations set during the humanitarian needs overview, where there's just like often a request of quantitative data and numbers, which does not really give the picture in the same way as qualitative data. This has been a great opportunity to share women's voices in a way that 1 or 2 or 300 words in a HPC document doesn't enable the reflection. So kudos to everyone. And yes, it's exciting how many coordinators we have on this call. So please keep reading the chat. We have some other discussions happening with Mali and also DRC, Noemi. So yeah, we're going to move to our next speaker, but you can still follow what's happening in the chat and let us know if you want us to set up a webinar. So we're going to now move to new guidance that is out from WRC on cash. And I know this is another area of a lot of interest, data and cash. They're trending issues. So we're going to have Tenzin present about the cash for GBV outcomes research that's been done by WRC. So over to you.
Thanks so much, Jennifer and all. My name is Tenzin Manel, and I'm Associate Director for Cash and Livelihoods at Women's Refugee Commission. I'm actually going to be tag teaming this presentation with Cassandra Pulse, who's our research advisor, and she and I are very much a team on all of our ongoing research on cash for GBV outcomes. We're actually going to be speaking today about ongoing work. Shiva or whomever, if you don't mind advancing the slide 1. So I'll give an overview of our current capacity building and evidence generation initiatives, and also share some key opportunities to engage, which we hope you will, as we go forward. And then Cassie will share a deeper dive into our current evaluations. We're doing 3 presently, and hopefully more to come, funding dependent. So over the past few years, as I think many of you are aware, WRC has been working on generating tools and guidance and training related to integrating cash and voucher assistance into GBV case management to support survivors' recovery where appropriate. And I'll underline and bold here, where appropriate. So we developed the Cash and GBV toolkit. We fed into the interagency development of the Cash and GBV compendium. And we also co-led with CARE development of in-person training curricula based on that Cash and GBV compendium. And so this year we are moving forward to continue building the capacity of GBV specialists to utilize cash where appropriate to support survivors. So with support from SDC this year, WRC and CARE are developing an e-learning accompaniment to the in-person guidelines, understanding that with COVID and increasing remote management settings, we really need to enable GBV practitioners to build their capacities online. where in-person gathering is not possible. So this effort is ongoing, and we'll be rolling out the materials in Q4 of this year. The training will link to existing e-learning materials wherever possible, including existing CASH and GBV online curricula, to not duplicate and point people in the right direction for that foundational knowledge and skills building regarding each area, CASH and voucher assistance, and GBV specialty programming. And we'll also feature as many practical examples as possible. So we will be knocking on your doors to gather those examples. And we will be training in total 300 practitioners at the field level, likely through virtual formats, but where in-person gathering ends up being more feasible, we hope towards the end of the year we can also meet in person. And these trainings will be paired with workshops that will gather coordinators at the field level from the GBV and capture and voucher assistance working groups and subclusters, etc., to focus on enhancing coordination and looking at what the current referral pathways are and how these can be strengthened. So these workshops will build on the examples of UNFPA to date, as well as some of the work that the Whole of Syria Task Force on CASH and GBV is working on now. If you could kindly advance one slide for me, please. Thank you so much. And then on the building evidence side, WRC has been funded by 3 donors. I mentioned STC so far. We've also been funded by BHA and ELRA, and we're undertaking multi-year, multi-context research to better understand cash and voucher assistance within GBV case management to support survivors. So we're looking at things like cash and voucher assistance design features are most effective, and Cassie will dive deeper into what the evaluations are tackling. Since October, we've been launching these projects in Northwest Syria, Colombia, and Ecuador as well. We're working with CARE in each setting. WRC is bringing the expertise in terms of how to integrate cash and voucher assistance into GBV case management, and also the evaluation expertise. CARE is bringing the cash and voucher assistance expertise and is delivering cash to GBV survivors, but via partnerships with local GBV service providers in each setting. So those GBV specialists, those caseworkers, are actually doing those individual assessments during case action planning as to whether cash and voucher assistance can be appropriate, and then coordinating with CARE to tailor the referrals as needed. So in each setting, as I said, we have local partners. In Northwest Syria, we're working with ISAN Relief and Development, in Colombia with Corpordinco, and in Ecuador with CEPAM. In addition, in Ecuador, we have another local partner, UNTA, who they are a union of domestic workers. And so their role in the project is really trying to enhance awareness about GBV services amongst displaced populations in that setting to enhance access and use. And in Ecuador, we'll also be holding a national level stakeholder workshop, where at the end of the project, we will share successful practice and advocate for uptake amongst those local government and civil society actors. We're also in the process through the SDC funding to identify examples where GBV response programming is using cash and voucher assistance within the whole of Syria response, so we can help document. So we have some modest funding to support the development of case studies that we can co-author and help facilitate. So please be in touch there. And that's probably a good segue to our next slide around opportunities to engage. So in terms of that e-learning, the training on the cash and GBV compendium, we are, I've shared to go out with the notes, it's AoR for the advisory group that WRC and CARE are co-leading. This advisory group is open. We are really looking for GBV specialists in particular who can bring experience using cash and voucher assistance within GBV response. And the advisory group has different levels of engagement based on bandwidth. So you can be a reviewing member and just help us review from a technical input stance. materials before they go out the door and are rolled out. We're also looking for contributing members who can be a little bit more hands-on and help us identify examples and materials. In addition, as we roll out the trainings, we're really keen to be in touch with your colleagues in Colombia, Ecuador, and across the whole of Syria response to participate. So please keep an eye out for that registration and feel free to be in touch with me as well. Those trainings are slated for November presently, so registration will be a few months before that. And then, as I mentioned previously, for these case studies in MENA, we're looking for partners, so please be in touch with me around that as well. Here, I'll pass over to Cassie to share with you a bit more about our ongoing evaluations. Cassie, over to you.
Thanks, Tenzin, and good morning, good afternoon, good day, everyone. I'm Cassandra. I'm a research advisor at the Women's Refugee Commission, and this is my first time engaging in this forum, so I'm pleased to meet all of you. So as Tenzin was saying, as a follow-up to the WRC's ongoing collaborations around the use of cash and voucher assistance in GBV case management programming. As a follow-up to that, the WRC, we're now coordinating a series of studies to learn more about the cash and voucher assistance integrated GBV case management program model, which WRC and CARE and others have developed out. And to that end, over the coming year, we have 3 studies ongoing, funded by ELRA and USAID. We have 2 studies. 2 of them are focused on quantitative, outcome evaluations of the CVA integrated GBV case management program model in Syria and in Colombia. The WRC is coordinating outcome evaluations of the program model, focusing on displaced survivors who have experienced physical and sexual GBV. We will also be complementing the outcome evaluation with qualitative research to learn more about the pathways of change and how the case management and the cash assistance may have worked together to support survivors' protection and recovery. And then finally, we have a 3rd study ongoing in Ecuador in collaboration with CARE and local partners, as Tenzin mentioned. Our focus in the Ecuador study and project is focusing specifically on intimate partner violence. And we are taking more of a formative research approach where we'll be using qualitative methods and participatory methods to sort of gain more insight and voices from survivors in this context about how cash assistance can support the recovery of survivors of intimate partner violence. Thanks. Can we go to the next slide, please? So here are the research questions guiding the 2 outcome evaluations in Syria and Colombia. And we'll also be using, developing similar research questions adapted for the Ecuador study. As you can see, the aim of these studies is to hone in on the effect of the cash and voucher assistance on the outcomes of survivors. And then using qualitative research to, complicate and triangulate and validate those findings. And then on the right here, you can see the various partners who are collaborating on these studies. Next slide, please. And here is a brief glance at the theory of change that is guiding our outcome evaluations in Syria and Colombia. In Ecuador, for the which is focused on the IPV on IPV survivors, we may have a more tailored theory of change. But for now, this is a glance at the theory of change guiding our evaluations. And as you can see, as I mentioned, we're really trying to hone in on sort of economic barriers to recovery and protection, and gather more learning about to what extent the cash and voucher assistance contributes to alleviating those economic barriers, decreasing risk and improving well-being, and to what extent might there be negative externalities, and what can we learn about improving design of cash and voucher assistance to alleviate any negative externalities. I wonder if I can, but great. And just to say that there will be a number of, we'll be sharing a number of products that come out of this research. There will be learning briefs for each of the studies, and as well as academic manuscripts that will come later in the, probably later on. But in the meantime, there will be learning briefs that maybe Tenzin can say more about where those learnings might be disseminated. So thanks for listening.
Thanks so much, Cassie. I've just put a link into the chat where you can access, it's also on the bottom of the slide, where you can access all of WRC's cash and GBV resources, which include current and future reports, trainings, tools, etc. Please stay in touch with us, and we're happy to come back again and share the findings of these evaluations. We'll also be conducting some standalone webinars as we make our way, and we'll make sure to share those opportunities too. Thanks so much. Happy to answer any questions.
Great, thank you. And we will, any upcoming webinars or anything that you have, we're happy to disseminate those through our website and through our monthly report. And I know Sarah Martin, who's online, will also is always willing to have you post things to the community of practice. So good ways for communication. We're kind of starting to run a little bit over, but does anyone have a quick question now? Otherwise, you can put it in the chat, and I'm guessing that at least one of you will still be online that you can answer questions in the chat. But does anyone have a question now? Okay, so if you think of a question, feel free to put it into the chat. And I kind of skipped over out of order, so apologies for that. But we're going to have Oswald, who's part of our Riga teams in West Africa, together with Noemi, who's also online. And he's actually had 2 in-person missions, not virtual, but in person, which feels quite amazing, to Cameroon and to Guinea. And so he's going to give us an update on those 2 missions. So Oswald, over to you.
Thank you, Jennifer. Good morning, good afternoon, colleagues. I will present on behalf of the REGA team in West and Central African region. My name is Oswald. I'm the regional in emergency GBV specialist in the REGA team here in Wakaro. I'm based in Dakar, hosted by UNFPA regional office. As Jennifer announced, we had 2 two missions in Guinea, one in Guinea and another one in Cameroon. And in Guinea, the mission was fully remotely last year and took place from 21 September to 20 December 2020. And in Cameroon, the first part of the mission was in remote from 7 to 31 December 2020. And I was physically in Buea in the southwest region in Cameroon from 7 to 28 January this year. Okay, Shiva, can you move to the next slide, please? Yes, the next one, the next. Okay, let me present some key results of the mission in Guinea, but before that, I would like to present the context and the mission peoples, because the peoples is different from Guinea and Cameroon. From Guinea, the mission was an emergency preparedness mission. The context was that Guinea was preparing the presidential election in October last year. And there was huge tension and violence observed ahead of the presidential election. And this called in mind the atrocities in the previous election in the country, the history of election in the country, as the last one, which was very, very strong. It was in 2010. Guinea is also one of the countries at risk and to watch for us as a REGA team, but also for the GRP COVID-19. It is not a COVID-19 GHRP country, but it mentions in the reports that it is a country at high risk and to watch. This mission was requested by 5 UN agencies according to the importance and the issues I mentioned above, which motivated the mission. UNFPA, UNHCR, AoR, UNDP, and the UNHCR. Thank you. Shiva, can you move to the next slide, please? Okay. Let's present some key results. The first one, it is a reactivation of the GBV working group in country. This doesn't exist since 2015, but we reactivated the GBV working group in order to allow the GBV specialists and actors to meet and to plan the response and to decide together the emergency action to be put in place in order to prevent and respond GBV issues in the country, and also to plan for GBV risk mitigation activities. It was very important to do that ahead of the election. And we get the support of the resident coordinator. This is very good to mention. It's as very, very, very good. And the all humanitarian team. According to that, we also updated the TOR for the GBV work group, because the first one, it was not linked to the humanitarian settings. So we decided to update the TORs and to include some points which refer to the core function of a GBV working group in humanitarian settings. We also had a training with the ECOWAS observers on GBV. I don't know if you know ECOWAS. ECOWAS is the Economic Community of West African States, I think. They was there to observe the election as a politician and not GBV specialist. The tension was very huge, and with the support of the resident coordinator, we decided to train them about how to respond to the disclosure of GBV and how they can organize ethical and safe referrals to specialized GBV services available. That was done and very appreciated by the ECOWAS observers. We shared with them a contact list, an up-to-date contact list of GBV specialized service providers, because there was not a referral pathways and GBV mapping services in country at that time. We trained also the journalists and local professional media on good practices in communicating about GBV in humanitarian settings. We used the guidelines, the IASC guidelines, I think it is 2040 guidelines for IASC, and we emphasize on the interest of GBV survival, which should be prevail over all objectives. We discussed with them also about the not only GBV principles, but the GBV survival approach. And I think this was very, very important for them to know, as they should not interview GBV survivors in case they, some of them came to seek for help. And we discussed with them what is the psychosocial aid in difference of an interview and the rights of a GBV survivor. After that, as I said, we established an emergency contact list in order to help them to refer in ethic manner and safety a GBV survivor to specialized GBV services. That was the main key results, can say, for Guinea. But this mission continue a bit. We plan to have other trainings in this month, this coming month of April, to finalize, because we faced some issues regarding the situation in the country at that time. And the main challenge was the tension after the election, which had allowed not the virtual mission to run smoothly because of the internet cards in the country and the restriction on staff movement. And this forced us to rearrange the missions program several times and result in the postponement of some activities. We continue the support with the country team, and we will finalize in this coming month of April with two trainings. One on the core functions, GBV coordination core functions in humanitarian settings, and also the psychosocial first aid for GBV survivors. Okay, Shiva, let's move to the next slide. Okay, now we are in Cameroon. The context in Cameroon, as I said, it's different from the context in Guinea. In Guinea, it was an emergency preparedness, but Cameroon is a HRP country with a humanitarian response plan. The situation is very complex, with 2 points I can say. The first one is the Boko Haram crisis, in the far north. We have also the socio-political crisis in the northwest and the southwest, and we have also the refugees from Central African Republic. To that, we can add also the pandemic, the COVID-19 pandemic, the HRP 2021 plan to meet for 24 million people in need. And this mission was requested by UNFPA and UNHCR. Shiva, can you move to the next slide about the result? Okay. Some results of this mission in Cameroon. The mission in Cameroon was to fill the gap of the GBV subcluster coordinator. So I went there to act as a GBV subcluster coordinator for the northwest and the southwest, and I was based in Boya region in the southwest region, but coordinating both the northwest and the southwest, and giving support also to the far west and the Antioch country. During that time, with the support of Naomi and Adish, my colleagues from Dakar, we strengthened the humanitarian need overview in the HRP, the GBV in the humanitarian need overview and in HRP. And we ensure that the GBV analysis is strong in the whole document, not only the GBV sectoral page or the protection page, but also in the other sectors. The GBV sector in Cameroon also undertook the CCPM, and hopefully they will have the report analysis of the findings shared recently by the GPC. And I also produced two situation reports on GBV in the northwest and the southwest, and this was shared with OCHA and integrated in the newspaper, the monthly newspaper of produced usually by OCHA in country, and published it at their website. The next slide, please. Okay. We had also, I organized a refresher training on the case management for sexual violence survivor. Why is that? It is when analyzing the data from the GBV IMS report in December, it shows that the sexual violence represents 42% of survivors of reported cases. Sexual violence represents 42%, which is huge. And among them, 57 are child and adolescents, and 6 are people living with disabilities. So we had a discussion with the GBV subcluster member about how to better support, how to improve the case management of sexual violence survivors. And we also had a discussion regarding the fact that there is a low rate of demand for legal services, only 1%, and security and safety services, which are available, but there is no demand in a context where the sexual and child abuse is very high. So we recommend that one of the GBV subcluster member or the coordination to do an in-depth analysis regarding that. And the result will be shared with the humanitarian country team to know. I know we can imagine the security issues, but we need to know further, to analyze further why there is a low demand of legal services, and we have 42% of violence, sexual violence among the reported cases. Okay. We also updated the 5W matrix and GBV services, updated monthly. We have the referral pathways also, which was monthly updated, and this is a practice in country. It is a best practice. I think we should do the same in all the countries. We also integrate and enhance GBV questions in the MCMA to improve the language, also to include the question which could allow us to have a situation on the risk mitigation, or the area where women and girls seems to be in risk, like the water point, the forest, and the other cases. In Cameroon, there is no the DTM matrix, so we cannot get those kind of information. As we have the MCNA, I found that it was a very good opportunity to include those kind of questions in that tools, and to have the feedback of people, women and girls especially, from the field. And I use that opportunity also to support the training of IOM field staff who are involved in the MCNA activities, and train them how to respond to the GBV disclosure, as they are not the GBV specialists. And we shared with them the GBV referral pathways, and we discussed about the GBV principles, and also we plan to have regularly meetings so they can give us feedback about the situation they face on the field. Over. This
you need to be wrapping up, okay?
Yes, it's okay. This is the last slide.
Okay, great.
Okay. Thank you, Jennifer. Over to you. This is the last slide.
Sorry, I didn't mean to cut you off immediately. It's just we have 2 more people. So I noticed that there are some questions in the chat for Oswald, and I hope that you have access to the chat, Oswald, and I know Noemi has already been answering some of the questions. And we can also provide you, if you have work in the field in either of the countries that Oswald has been working in, we're happy to provide you with his email so that you can coordinate. I see that Nancy from the GPC is communicating that she's been supporting the protection cluster there. So I will, and I see there's some questions about the media training from OHCHR. Great to have OHCHR on this call. But I want to make sure we have enough time for Sarah Martin and Joe Reed. So Sarah, I'm going to hand over to you next. And she's going to be presenting. Sarah is our moderator from the Community of Practice. She's also famous now, one of the 100 women that just won an amazing award for recognizing her great work. So congratulations. And she's going to be talking about the webinars that have been happening for the guidance note that was developed by a number of our core members with support from the help desk on guidance for COVID-19 and the shadow pandemic. So over to you, Sarah.
Thanks very much, Jennifer. Very kind of you. So I'm the Community of Practice moderator with Beth Van, who many of you also know. And we were approached by the help desk, our colleague Laura Martinez-Searles, who we work with really closely, to pull together a webinar launch of the toolkit for COVID-19 guidance on remote GBV services. So many of you, I think, were involved in developing this toolkit. It was definitely a multi-agency effort. I believe it was UNICEF, UNHCR, UNFPA, IMC, IRC, Trocare, Norwegian Church Aid, and Plan, along with the GBV IMS people and the capacity building for case management folks. So they had the help desk finalize the toolkit and pull it together. So we wanted to do something a little bit different with the webinars. Along with Philippe, the GBV AoR communications advisor, we've been noticing that when we do a 90-minute webinar, because 90 minutes is about the amount of time where you can actually present all the information in 60 minutes, and we always want to have time for discussion and for questions and answers, but there's a huge drop off, usually in about 45 minutes to 50 minutes, you know, and because everyone is kind of running from meeting to meeting and call to call. And what we're looking to do, because there's so many competing, you know, webinars and information sources and events going on, we tried to do something a bit different. So we broke it into two things. One of the things that we'd like to start doing is using video to better promote the tools that we're creating. So there's lots and lots and lots of guidelines and tools out there, but we're noticing on the community of practice that, you know, a lot of people are not familiar with them. They're not aware of the tools that have already been developed, or they haven't really had a chance to sit down and go through them. And I think a lot of us are struggling, particularly during COVID, to just sit down and read. There's not much time or space to do that. So what we wanted to do was have a video that presented the tool and what was in it very practically, that we could then use later, you know, and I don't know if all of you are aware, but the GBV AoR has a YouTube page as well, where we've been putting up all of the webinars that we've been conducting through the community of practice and through the REGS. So we wanted to be able to take the video and maybe even chop it up into little pieces so that we could promote it either through social media in different sessions, with the idea perhaps that being able to have, maybe if you only have a 10 or 15-minute video that explains one portion of a tool, you could use it at coordination meetings, you could use it, you know, for staff development, you could do it for trainings, or you might just have a little bit more time to sit down and watch a 10-minute video rather than a whole hour, hour and a half video. So what we did was we had the first webinar, and it was very well attended. So I think there's an appetite for these. There was over 500 people registered, and I think in the end it's, you know, it was about 880, which is still a very good turnout for us, come to the first level of the webinar. So Micah from IMC, Elfrida from the UNICEF GBV IMS team, and Fiona from Trocare introduced the different chapters within this guideline. So Micah did an overview, and it was very much focused on, this is what's in it. If you go to this page, you can find, you know, the script for your phone operators. Or if you go to this page, you can find more information on ways to do that. So, and we kept it to 1 hour, and we found that we had almost no drop off. So we did not take any questions or answers, and it was not at all participatory. It was really an information delivery session. But because we want to hear from people who are using it in the field and how they're using it, a week later, we had a second event, which was, we were billing as a facilitated discussion. So we brought in 12 different people from the field. So we had people from UNICEF in, oh, I'm going to get it confused. I don't have it written in front of me, but people from Lebanon, people from Libya, people from Jordan, people from Nigeria, people from Bangladesh and Cox's Bazar. So from all different agencies, so NCA, IMC, IRC, UNFPA, UNICEF, and we paired them with a facilitator. And so we had this event was 90 minutes long. And so we started off with a plenary where the 6 facilitators had 5 minutes, or even less, 3 minutes, to just kind of explain how they had adapted it to their setting. And then we broke everyone into breakout groups. And so each of the speakers was paired with a facilitator who either had worked on the project with them or knew it or was somehow involved. And then we opened it up. We had like a 30 to 45 minutes breakout group where they could all talk to each other, ask questions, share their own experiences. Now, one of the things that was a bit stressful about that is, we haven't had our own Zoom account at the COP. So it was the first time really using for such a big webinar, all the breakout groups. And I understand now there's even ways they've just changed the technology where you can go to a breakout room of your session, of your choosing, which I think we'd like to do in the future. So because we had, places from Asia, we had people from, West Africa, we had people from the Middle East, it would have been probably good for the participants to be able to choose the breakout group that they wanted to go into. The other drawback on this was with the language and the translation. We didn't have funds for interpretation, so we had to do the whole thing in English. But still, it was very successful. We did a survey right afterwards, and it got very high ratings, and people really appreciated the chance to talk with others from other field settings who were kind of struggling with the same things, to share ideas. And then we also took the opportunity in the webinar to ask them what further support they need and in what kind of form that they need that in. Kind of unsurprisingly, webinars are not high on everyone's list. I think people are quite webinared out. People really want face-to-face trainings. They really need, I think, that different energy that you get in the face-to-face trainings, but they're also interested in the videos and using the video opportunities. So that was the findings from that. We were pleased with how it went. We're still trying to figure out how to use the different recordings from the second version to see if we can either take a transcript from it and create a small document so that people can read it, or maybe turn it into a small video. We're still thinking about that, but that's it for me.
Thank you so much, Sarah. And I think, all of us are looking for better ways of communicating as we all become Zoomified. And so I think, learning and experimenting, exploring new methodologies is always useful and appreciated. So if anybody has any question for Sarah Martin before we move over to Joe Reed, or if you want to put it into the chat, we can take one question for Sarah if anyone has one, or if somebody else who took part in the webinar experience and they want to share their own experience and how this was compared to other experiences, you're welcome. I know my team was very excited about this particular webinar. And also Sarah is reminding you that if you're not a part of the COP community, you can join by using the email that's in the chat. So I don't see any hands raised. So I'm going to turn over to Joe. Also, I just said we didn't do it at the beginning, but if you want to put your name and if what your role is and where you're based or where you're working, those are not always the same question. Feel free to do that now, just because it's nice for others to see. I see a great deal of diversity, but not everyone recognizes you by your name. But we have Peru, Venezuela, Cameroon, and we have really great from all over the world, whole of Syria. We have Asia, Bangkok. So it's exciting, but if you want to put that in the chat, then everyone will see where you're coming from, and a good diverse group of organizations as well. I think Joe is taking out her dog. Any question before Joe starts to Sarah? Okay, so when Joe returns, I think I don't know if her dog was barking or something, but actually while we're waiting for Joe, Shiva, do you want to announce quick the HNPW side meeting? Or yeah.
Yep.
Go ahead.
Sure, I think Pamela left. She's organizing a session for Humanitarian Network and Partnership Week, which is the first week of May. And yeah, she's not here to announce it herself, but there is a session on how climate change fuels gender-based violence. And it's on the tools and data for gender inclusive early warning system and the GBV early action intervention models. This takes place on 4th of May. And it is 9 to 10:30 Central European time. We will send the official invite shortly when we have the link and connection details, but I just wanted to mention here so that you know this humanitarian HNPW week is happening, and we have GBV session related to climate change, and the session is mostly based on the help desk paper that is also coming out shortly about the same topic.
Great.
I will also put the info in the chat.
And we're also going to have a virtual room, as are the other AoRs, which is on the 12th of April from 2 to 4 Geneva time, but we'll send that out as well. And we'll have REGS available there and help desk and different people from the coordination team. We've invited the COP so that people can come and, as you would in person, visit a stand. The idea is to have a virtual stand. We're not sure how it will work, but we'll be exploring that. Over to you, Joe.
Thanks, Jen. Apologies for that. Of course, the delivery happened while I was waiting to start talking.
We thought maybe your dog was barking, but we were waiting to be introduced.
Yes. Sorry, Jen, I have to just be so short with time. I'm going to introduce you to the dog another time. So thanks very much. I had asked for some time just to discuss the IASC GBV Roundtable follow-up meeting, which I think we had discussed in January. At relatively short notice, a meeting was put together between IASC Principals and a select group of donors that included the EU, the UK, the US, Norway, and Denmark, and Canada, but didn't include some other key European donors in Australia. And I know that many of us had touched base bilaterally and through the core members group in January, just to express the challenges with the way that the agenda had been developed, and we felt that it hadn't given us the opportunity to really strategize about making sure that prioritization of GBV and very much the follow-up to the discussions that we had throughout last year when we were trying to get GBV prioritized and included as a standalone objective in the Global Humanitarian Response Plan. So now that discussions have become underway again about a follow-up being developed, I understand that Denmark have volunteered to coordinate such a follow-up meeting, but that the IASC Secretariat have so far indicated that this will be subject to approval from the IASC Secretariat in consultation with the OCHA Assessment Planning and Monitoring Branch, which many of us will recall were the people who weren't on board with GBV prioritization last year in the GHRP. So I just wanted to raise to the group, is there a way that we can be proactive as the GBV community? Which, you know, I think that there is a role for us, not to say that we want to burden Jennifer and the GBV AoR Secretariat team further, because we know you're very busy working on a lot of different projects. But I think it would be useful for us to clarify, and we don't have time now, but to maybe come together and agree what our priorities are for a follow-up IASC GBV roundtable in consideration of the sort of defensive position that we were in January, where we were saying, well, look, this meeting shouldn't only be about tracking GBV funding. It needs to be about GBV prioritization. It needs to be about a lot of other things. And in particular, one of the concerns that, you know, we raised a lot in January was the really limited opportunity for NGO participation. So only one of the 3 NGO representatives at IASC Principals level was invited to participate, which I think is another reason that it makes sense for the GBV AoR, which is our community, to come together and agree what we want to set as the agenda, because it is our agenda to set as the GBV community. And it would be useful for us to inform Denmark of what we are looking for. That's it on the GBV roundtable. I had also asked for a minute on Tigray, but I'll understand if we don't have time.
We have 5 more minutes. You're the last one on the agenda, so you can take 5 more minutes if you want to
Okay,
talk
but
about.
is there anything anyone wants to say on the GBV roundtable? I can see Lee Ashley writing. And so Lara has asked who's supposed to participate in the IASC roundtable. So I'm happy to share with Jen for the minutes who participated in the one in January. I know that UNHCR, UNICEF, UNFPA, OCHA, IOM, and WFP all participated, in addition to Interaction and the donors that I named. I don't have the exhaustive list at the tip of my tongue, but I will be able to send it to you. The suggestion that we made through the various representatives we were able to get to before that meeting at very short notice was that if there's going to be an IASC discussion on GBV, it needs to include all IASC members. And actually taking an approach where only the select few are picked, and there isn't an inclusive process by which the technical GBV community is consulted or included is a challenge.
So you're getting supportive comments in the chat, which we will be, and we have Ashley from BA.
If I can just come in, it's April here. Just to say that we will be having an internal meeting as OCHA to look at how we follow up on this on the last roundtable. So definitely I'll raise these issues and reinforce what Joe said in terms of making sure that the roundtable, if there is a follow-up, that it can be a bit more inclusive.
And April, we're happy to discuss with you, as mentioned by Joe, from the GBV community, how we can work on something together. I also, and I haven't seen the minutes yet, but I know there was also just a localization meeting at OPAG, which I'm also interested to hear, what issues came up. I think that was around the guidance note that's being endorsed by IASC. So appreciate, Joe, that you've raised some of these issues, and there's lots of feedback in the chat. So positive remarks. And I would say if you want to say something about Tigray, you still have time. So
great.
Yeah.
And because Tigray is such a terrible subject, a horrific situation, I'm offsetting this by bringing Stevie back as per Jennifer's request, so that you have something nice to look at. So as folks may already know, the HRP for Ethiopia has not yet been released. It's awaiting approval and sign off at Addis level. But there has been a lot of push from donors to hold a Tigray pledging conference as soon as the HRP is signed off. So one of the things that I mentioned earlier during the fantastic presentation about the voices from Syria is that I think, whilst it's been very useful for us to pull together these short, sharp briefing notes ahead of the DRC conference, the Lake Chad Basin conference, and others, I think being able to put together something more comprehensive, like a Voices initiative, would be fantastic if we have, a few months lead-in time, which it looks like we do, given that we're waiting for government sign-off. But I would also really welcome connecting with anyone who's interested to look at how we can influence the priorities and make sure that women and girls are a priority and that GBV is a priority in the pledging conference. We know so far that 35.6 million SURF allocation and another more than $150 million raised by NGOs has not included a proportional funding of the GBV requirement for Tigray. And we know that the GBV risk is a huge concern at the moment in particularly new displacement sites who are receiving over 1,000 new arrivals a day in Shire, and we're having rapes reported because of a lack of access to safe sanitation facilities, safe shelter, and lack of access to food programming. So I would suggest that and I suggested this to the POG as well, but I think it goes beyond an advocacy issue, and it goes, speaking to our technical colleagues, I think it would be useful for us to look in a strategic way, engaging also with Jessica and the regional team, of course, how we can be very proactive and engage with not just the UN agencies, but the local civil society responders in Ethiopia on what we want to get out of the pledging conference and the minimum that we'll need to have in terms of prioritization and requirements for GBV. Thanks.
So just to add, just to say, Jessica Gorham, who is the Riga that we have in Nairobi, they had a donor meeting very early in the year that I heard was quite comprehensive, and there was a briefing note that came out of that. And they've done a few different sort of advocacy messages in the region. And then just to say, the PARG has developed a statement that they're ready to release. We understand the call to action has also created a statement. There's some questions, I think, being raised right now about what kind of communication is the most effective. Does it make sense for each of us to be coming up with a statement, and what should be included in that? I know that yesterday in the PARG meeting, there was a small group that has formed to specifically talk about Tigray. So if there's others who are interested in joining that, they can be in touch with Lena, who's running the PARG from the IRC. And I think, yes, we were very concerned about the small portion of funding that went to GBV from the last SURF. So I think that is a very important issue to look at, is, you know, how can we ensure that the prioritization is there for the next round of SURF, if there is one, or promote that there be one. And I think, you know, everyone here on this call has been concerned. So again, let us know if you want to join the PARG group, or if you're part of the call to action. You can also be communicating through if you're part of the NGO group or the IO group or the donor state group. What we've been requesting as the AoR is that anything that's going to be released and sent out globally, or posted on websites, et cetera, be first run by the subcluster coordinator, who's in Ethiopia. She's right now in the field, which is why we're not able to communicate. The communication is very sparse in terms of just being able to, you know, there isn't good working internet. But also just to say, our core member, Fiona from Trocare, has gone there now. She's going to be providing training for case management. I think, I don't know if you're still online, Micah from IMC, but I heard she's heading out. So we also have some core members who will be going and will be able to share experiences. And I think we're overdue on a donor call ourselves, so we could take some of these ideas and see what makes sense to move forward and try to channel things in a way that we can be most effective. So also open to any proposals or suggestions that you have. Please share them with us at the AoR. And if you want to join on the advocacy, please do join the group in the PARG, the Policy Advocacy Reference Group, or channel your comments through call to action. Any statement, any last word? I'm trying to end us on time. We're 3 minutes over. Any last comment from anyone or AOB? It could be a comment on something from today, or if there's another announcement you feel like we need to know and you haven't had a chance to put it in the chat. And I hope you have had access to the chat, because it really does show so much diversity: Myanmar, Iraq, Peru, Venezuela, Cameroon, Syria. I mean, just really from all over. We have DC based people and New York and Geneva. So global, and like I said in our last call, we're very open to having you use this as a platform to inform us of new tools or you know, field experiences. We want it to be a blend of global and field, and do give us feedback if you have ideas of how we can improve. This is not a webinar, it's a call, but it's an update call. And you will get the recording, and all of the PowerPoints that were presented today will be made available believe on our website, as well as sending it out in our monthly update. And please do feel free to give us information also to share on our monthly update. So, and thank you for the donors who've also joined this call. Okay, Noemi, do you want to really quickly say it's for coordinators, so maybe we can share. There is a GPC Global Protection Cluster retreat coming up for coordinators, and there's the forum that they had last year. It's going to be much shorter this year. So the first part is for coordinators, more technical for coordinators. And then in September, we'll have the bigger open one that's for any protection actors or more broadly other clusters or anyone interested, that will be happening in the fall. But you'll get more information via our monthly update. So if there's no other comment, we'll end here. Thank you all. And just a reminder that it is 90 minutes and it will continue to be the last Tuesday of each month. And we have moved it to 2:30 Geneva time so that our Asia colleagues can also join. It's their evening time, so it's after working hours, but at least they're still awake. And so sorry if it's a bit early for all of you in New York and DC. But in Latin America, because Venezuela is 7 hours the other way. So we're trying to be as accommodating as possible. And sorry for those of you who are very early or very late, but we're trying to do it while everyone at least is awake. So thank you very much, everyone, and have a nice rest of your day or evening. Bye.